Begin tonight with the very latest numbers on COVID-19 here in Utah. The State Department of Health reporting 495 new cases. 3 more Utahns have also passed away, bringing the state death toll to 152, and 18 more Utahns have been hospitalized. Today, Utah saw the second highest single-day increase in cases. If numbers continue at this rate, we will overtax the state's hospitals. That's according to the Utah Hospital Association. ABC4's Brittany Johnson live in the studio with the organization's solution.
Well, Glenn, look at this graph behind me. You see the dark purple area right here. This goes back to June 15th. This is the number of people in the ICU confirmed to have COVID-19. This light purple area you see across the board is the number of people in the ICU suspected of having COVID-19. This dark green area is the number of non-ICU COVID cases. And then this light green area is the number of non-ICU people with COVID suspected to have COVID-19. Now, this light green area is the area of concern because according to the Hospital Association, people in that area are very sick, and that's the area of worry because in some instances, 50% of the people in these light green areas at one hospital ended up in the ICU. Now, to get those numbers back down, the Hospital Association says Utahns need to follow 3 rules. Thursday, June 18th, Utah's second largest one-day increase in COVID-19 cases.
When we talked Monday night, I said we're concerned but not alarmed. Let's just say we're troubled.
Greg Bell is the president and CEO of the Utah Hospital Association.
Things have worsened. We've seen a distinct uptick, and the trend is not good.
Bell says the state is testing the same amount of people, but more of them are testing positive.
We've had a historical rate of 4.3% positives among our testing. That now is running more like 8 and 9%. That's a scary number.
The reason?
Clearly, people have gone on with their normal activities. If we keep the rate of this increase going, then by the end of summer, we're going to start having capacity problems.
And not only with the number of hospital beds, according to Bell.
There are only a certain amount of trained nurses and techs who can administer the life-saving tools, medication, machinery that this requires.
Bell says it's important to open the economy, but the trade-off is people need to be wearing masks, practice social distancing, and vulnerable individuals need to shelter at home as much as possible.
If we do those things, the hospitals feel like we can continue to enjoy the amenities and businesses, restaurants, etc., that have been open.
With no vaccine or herd immunity, Bell says Utahns need to be taking those extra precautions we mentioned in that story. Glenn, back to you.